Meet me in the middle.
Welcome to Meet Me in the Middle. I am Kirsten Cole, your host. We love to explore all things midlife. We're talking about women. We're talking about the fact that your best years aren't behind you. They are being built and are in front of you. From your power, your health, your relationships, your money, we want to dig into all the things that are so important to making your life as optimal as it can be. And today, we have a terrific conversation on hand. We are talking about all things when it comes to treating depression and anxiety for an alternative treatment. Talking about psychedelics. And I'm sure you've heard the term before, but we're talking about this in a medicinal and clinical space. Say hello to Dr. Casey Palios. Thank you so much for being with us.
Hi, Kirsten. Thanks.
Psychiatrist, great to be with you. Founder of the Innermost Clinic, which is here in New York City, in the Nomad area. You have been treating people with psychedelics for 10 years, specifically ketamine.
Yeah, ketamine.
And there's more than just ketamine when we talk about psychedelics. There are psylocibins, there's Spravato, there's, what else are we, MDMA?
Yeah, right, yeah. I've been doing research with psychedelics going back about 15 years. I was involved in a psilocybin for cancer-related anxiety study at NYU as a study therapist. We also later on did ketamine for a depression study at NYU as well. And then later, I was involved as a principal investigator and study therapist in the phase 3 clinical trials using MDMA-assisted therapy for PTSD.
So not only treating and using psychedelics, but also studying the whole space. And this is really important to talk about. I pulled up research on this. 1 in 5 Americans will deal with depression or anxiety. Women, as we go through midlife, as we go through perimenopause, menopause, postmenopausally, comes with huge hormonal shifts. And so women who may have had any episodes of depression or anxiety in the past may see it revisit again. You were pulling up a really interesting reason why this can happen, because we know there are so many changes when it comes to this time of life for us that we exist in for decades, really. And what is going on in our brains that is changing in that menopausal era?
Yeah, well, with menopause, obviously, you're seeing, as you said, a lot of hormonal changes, and predominant among those is decline in estrogen and progesterone levels. And the estradiol or estrogen decline in particular seems to be correlated with a decline in a type of receptor for a neurotransmitter called serotonin. It's the 5-HT2A receptor.
A lot of us have heard about serotonin. This is the brain chemical that makes us feel happy.
Yeah,
right?
It's connected to mood and anxiety, and it's definitely very much implicated in depression. And so, if the hypothesis is as estrogen levels decline and these serotonin receptor levels decline, it can make a woman more susceptible to depression. And what's interesting about certain psychedelics, particularly psilocybin and LSD, they are particularly potent activators of that receptor. So
that same receptor. The one that sort of gets a little wonky when our estrogen levels dip.
Yes, the 5-HT2A. And so there might be smaller numbers of that receptor around because of menopause, but with more potent activation of it, might be able to counteract that. I mean, that's just a hypothesis, but that certainly, I think, is implicated. That serotonin receptor is implicated in, I think it's very likely implicated in the mood disruption we see in menopause.
And it's so interesting because there's so much that is now being studied in this space when it comes to women's health. No longer are we being told nor accepting to be told, you'll be fine, get over it, it's just a phase. It's a real and significant time of change in our lives, and it can really be addressed in so very many ways. I would be really curious in the HRT space, sort of what those correlations are as well. Hormone replacement therapy, if you're able to supplement back in the estrogen, progesterone, testosterone for women, thyroid perhaps, that maybe that this could help to optimize those receptors as well. But I'm probably getting a little ahead of myself, or I'm giving everybody an idea of something that could also be studied.
Yeah, yeah. I think it's a very fertile area of research.
Yeah. And so let's do a 30,000-foot view. I think the first thing we need to say is this is not about self-medicating.
No.
Because when you have a casual conversation with people about these substances, they might say, oh, I've heard about MDMA. I've heard about psilocybins. I've heard casually in circles of friends, people tell me that they're microdosing psilocybins.
Yeah.
I don't know what that means exactly. And probably it's not a defined black and white type of situation. But people are using these substances, but they should not be using it to treat their own depression or anxiety.
Yeah. I mean, there is a lot of kind of what you might call underground use of these substances.
Right.
The legalities around these substances are changing around the country.
Right.
Jurisdictions in Oregon and Colorado and New Jersey recently changed some laws around psilocybin in particular, and
making them legal for recreational use.
Not recreational. So in Colorado in particular, it's legal for clinical use. So it has to be at a sort of a state approved clinic with people, practitioners, psychiatrists, and psychotherapists that have gone through, pretty rigorous training and certification process. New Jersey just passed a law that approves clinical research. Basically, they're going to be designating like 3 hospitals around the state and funding, I think, around $2 million worth of research in psilocybin. So it's not legalizing it.
And why is this so important? We have so many drugs for depression and anxiety.
Right.
And when I watch television, see that there are so many drugs being offered for people who may need something extra in addition to the drug that they're already on for their depression and anxiety. So am I getting to sort of maybe what the issue is?
Yeah. I mean, I think you are. I think, we've had now 50 plus years of conventional drugs, psychopharmacology, like things like antidepressants, anti-anxiety medications, SSRIs. These have been around for decades now, and they can definitely help to some extent, but there's millions of people for whom those drugs are not sufficient.
And they call that, what is that condition when that's
like
going on?
Treatment-resistant depression.
Or anxiety.
Or treatment-resistant anxiety. Yeah.
Right.
So,
and a lot of people really do legitimately struggle and suffer from this.
Yes.
But you're saying there's hope with an alternative treatment that is happening with the help of doctors, with the help of people to guide you through this process. And we're going to get into exactly how that works, because this is a fascinating area of medicine. We're going to take a short break. And when we come back on the other side, we're going to talk about what happens at Dr. Casey Palios's clinic, Innermost, and other clinics like it, and how people are being helped when we come back on the other side of this break for Meet Me in the Middle.
You're watching Meet Me in the Middle.
Welcome back to Meet Me in the Middle. We are talking about all things psychedelic, and I'm not talking about you taking some sort of a weird trip at a concert with a bunch of friends. I'm talking about treating perhaps anxiety or depression, especially when it's treatment resistant for the ways that we have traditionally been approaching this. With me is Dr. Casey Palios. He is the co-founder and director of the Innermost Clinic. You've been treating patients for decades in emergency rooms, in really severe acute cases, and now you found another way to treat patients. Talk about how psychedelics are being used in this clinical setting and what happens.
Yeah. So as we were discussing earlier, conventional psychopharmaceuticals for depression and anxiety have been around for decades and really fall short in many cases.
Some people really get stuck.
Yeah.
And they're, especially if there are traumatic events, PTSD events, they just can't seem to get off the wheel.
Right. Yeah. And I think, so the thing to really factor into our thinking here is what those conventional drugs are designed to do, which is to suppress symptoms. So somebody comes in, they have a lot of anxiety or they have a lot of depression, and we can give them a drug that can alleviate the symptoms, which is obviously helpful in the short term, potentially
Mhm.
even life-saving. But if that's where the treatment strategy sort of begins and ends, you're really not addressing the root cause. So
Because people, the complaints that they have from these medications are sometimes they just feel numbed,
yeah.
right? And they work
Hmm.
with their therapist
Yeah.
to work through what could be part of what's driving it, but not able to kind of like
Yeah.
break the cycle.
Right, right. So, and I think in certain cases, because they're numbed, because the drug sort of disconnects them from
Right.
the source of feeling, which provides relief, but it also sort of it makes it more difficult to access the underlying cause, the
Hmm.
psychological wounds that are underpinning the symptoms. So, it's what's important to recognize that I think the conventional treatments kind of really sort of overlook is that these symptoms are not just nuisance problems to be eradicated. They're actually signals from an intelligent system, the mind body, that are trying to communicate something. And what they're trying to communicate is there is an unhealed wound here. There's an unhealed psychological trauma that needs the right conditions in order to heal.
Hmm.
And what these drugs can do is in the right, what we call set and setting. So the right context, contextual factors.
The psychedelic drugs.
Yeah, the psychedelic drugs. Yeah, thank you. What those drugs can do is instead of just mask the symptoms or suppress the symptoms, they can create a temporary state in the mind and brain that enhances access to these psychological wounds. And then with the skillful uh, guidance of a psychotherapist, that state can then be leveraged to actually get at the root causes of a person's symptoms at the actual psychological wounding.
That has to be transformational.
It can be, yeah, for many people.
It almost sounds like a safe space.
Mm, yes. Well,
I've interviewed other people about this, and they sort of talk about how they're there, they're present as they're journeying, but they're not being harmed. And
mhm,
they know in that time that they're okay, that they'll be safe.
yeah, yeah.
Is that accurate?
I mean, if the therapist is doing their job properly and
Right.
creating and helping co-create with the patient, with the participant, that atmosphere of safety, then absolutely. And what we say about psychedelics often is that they're these non-specific amplifiers of consciousness, which is to say that whatever is happening in your experience, these things are going to magnify. So if there is safety in the space between the patient and the therapist, that's going to be potentially magnified under these states. But if there's a lack of safety, that could also be magnified. So
Uh,
there's a potential risk here too. If these aren't used properly,
mm.
they can actually cause damage and harm. This is why people have heard, I'm sure, of this phenomenon of a bad trip.
Right.
It's that is basically a phenomenon that happens when somebody takes a psychedelic, one of these non-specific amplifiers, and then finds himself in a very scary or adverse type of situation. That gets magnified and can be quite harmful. So these are powerful tools that really shouldn't be used without the proper guidance and expertise and
In other words,
safeguards.
don't use them recreationally to try to repair yourself.
I mean, you're taking a real risk. You're kind of taking your mental health into your own hands when you do that.
Right.
So, yeah, I would say, especially if somebody has a real significant history of trauma, I would very much recommend against that.
So how this is happening all around the United States, these
Yes.
types of clinics, right?
Yeah.
And are they all using the same the same psychedelics, the ketamine, the Spravato, the MDMA, the psilocybins?
Well, so right now, the only thing that's legal uh, for conventional or for widespread common clinical use is ketamine and Spravato. And Spravato is also kind of a form of ketamine that's
Hmm.
been FDA approved for depression.
And that's the nasal
That's the
mist.
nasal spray. Yes.
And then ketamine, when it's administered clinically
Yeah.
in a setting like yours, is that an IV?
It's typically either an intravenous injection or sometimes it's an intramuscular injection.
Mhm.
Sometimes we also use a sublingual tablet that gets compounded by a specialty pharmacy. But yeah, so there's various modes of
And how
administration.
long is somebody in this state that they're accessing?
So it sort of depends on the route of administration, but typically it's anywhere from 45 minutes to an hour and a half. Sometimes in a long psychotherapy session, you may administer multiple injections. So one at the beginning and then maybe a booster
Mhm.
a few minutes, 20 minutes in or so, and that can extend the effect. But yeah, by and large, the ketamine and Spravato lasts 1 to 2 hours at
And then how
most.
many times does somebody need to go through this type of treatment or journeying?
Yeah, so it depends on the person. Also depends, I think, very much on the psychotherapy that they're doing. So there are some clinics that are kind of using these drugs more in the mold of a conventional pharmaceutical, where they're just using it to suppress symptoms. That I think is, I don't think that's causing harm per se, but I think it's kind of a lost opportunity, because what happens with these drugs, ketamine and Spravato included, is they create this window of enhanced neuroplasticity. So what that means is the brain is put into a state of enhanced ability to adapt and change in response to what's going on experientially for the person. And so when you combine a psychotherapy with that, you can really deepen the effect of the psychotherapy. So I think,
It
you
sounds like what you're saying. I'm trying to divine all of this, and I don't have the degrees and the
mm,
experience that you do, but it sounds like you're actually getting in and perhaps healing that wound, addressing and healing it.
that is the goal. Absolutely. Yes. And that happens not by the drug alone, but with, the combination of psychotherapy
Mhm.
in this, in the non-ordinary state and the enhanced neuroplasticity. It lasts for days, even in an ordinary state of, after a person returns to ordinary consciousness, this neuroplasticity effect persists. So, it does typically require multiple treatments, but,
Mhm.
the course and how many are required kind of vary from person to person, depending.
So would some people have 3 or 4 or
Typic
6 or 10 or
Typically, if somebody's coming in with severe treatment-resistant depression, we're gonna be doing a series of 6, intravenous infusions. That's kind of the default. Or if
over the
they're
course of how long?
usually like 3 to 6 weeks.
Mhm.
And if it's Spravato, obviously it's a nasal spray, but, sort of similar. With Spravato, it's 2 treatments per week for 4 weeks, and then it goes down to once a week for another 4 weeks, and then we kind of see how people are doing after that. Hopefully by then their symptoms have, substantially improved, and they can enter, if they're doing psychotherapy, maybe they don't need another treatment, or maybe they need to come in for maintenance once a month or every other week or something like that. It kind of depends.
Fascinating conversation. We're going to take a little break here, reset. When we come back on the other side, we'll talk about who these patients are and maybe how many of them there are, so that we can begin to understand who would be eligible and who would not. We're so glad that you're joining us today on Meet Me in the Middle as we explore all things psychedelics, so that we can take a look at depression and anxiety, which plagues so many of us in our middle ages, when we come back on the other side.
You're watching Meet Me in the Middle.
Welcome back to Meet Me in the Middle. We are exploring an area that so many of us seem beleaguered by in our middle ages. It's dealing with anxiety, it's dealing with depression, and some of it is being physiologically driven because of the fact that our hormones are shifting and we're losing estrogen, and that may be impacting the receptors in our brain. So now we're talking about one of the ways that science is stepping in to perhaps help you out. Welcome back, Dr. Casey Palios. Thank you so much for being with us. This is when we talk about delving into psychedelic therapy. This is not the first line. If a woman is in middle ages and she says, "Phew, things are really shifting for me. I'm feeling so much more anxious. I'm snapping at my family. I seem to not be motivated to do all of the things that were so important to me in my life." This is not going to be the first line of treatment that somebody's going to talk to her about.
At this stage, no, it's not. I mean, maybe in years to come, it might become more first line, but right now, first line treatment would be a conventional antidepressant, perhaps something like, Prozac or
Mhm.
Zoloft, an SSRI, or
And we see a lot of that prescribing happening at
yeah,
this phase
yeah,
of our
for
lives.
sure. And ideally, whoever's prescribing it is also either conducting psychotherapy or recommending that the woman go into psychotherapy, because we know that the combination of drug plus psychotherapy is more effective than either one alone in most cases.
Right.
And that's certainly also true with psychedelics. But typically, what we see nowadays is, if somebody's tried that conventional treatment and it's not responded well enough, they will then come to a clinic like Innermost to do ketamine or Spravato. Um,
And is the goal to get you off of all of your medications?
it's not an explicit goal most of the time, but sometimes or often people do want to come off of the conventional drugs.
Hmm.
They can cause side effects that are unpleasant, and this numbing effect that you mentioned earlier is a real phenomenon. And uh,
Sexual dysfunction,
sexual
also people
dysfunction,
lose their appetite for that, and
yeah,
that can be really tough in a
yeah,
relationship for on both partners.
certainly, yeah. So these, and one of the major differences between psychedelic assisted treatments and a conventional antidepressant or anti-anxiety med is the conventional drugs are things you need to take every day. And so you're putting a chemical in your body every day. And so you're going to be having side effects that happen every single day. And if you're
Hmm.
taking it for months or years, that's how long the side effects are going to last. Whereas with psychedelic assisted therapies, ketamine and Spravato, these are not given every day. They're given maybe once or twice a week in the beginning. And then maybe after that, we're reducing the frequency to once a month or even less. So these are, relatively speaking, much, much smaller exposures to the drug, which is obviously quite helpful in terms of the side effect profile. They tend to not have as many side effects, and they don't.
What are the side effects that people deal with when they're going through this therapy?
So most of the side effects happen when the drug is actively in the system. And so, as we said before, the effects last anywhere from an hour to 2 hours.
Hmm.
And certainly during that period of time, a person is going to be in a non-ordinary state. You can call that a side effect, or you can call it sort of the goal if you're combining it with psychotherapy, but that's certainly an effect of the drug. And then, they're going to have dizziness, they might get nauseated, they might have double vision. And so oftentimes when a person comes in for these treatments, we're being very careful around the conditions that they're doing the treatment in. So, they're generally in a very nicely appointed room, in a comfortable chair. Oftentimes they're wearing eye shades
Hmm.
and listening to music through headphones. And, we have sort of curate the experience to make it very pleasant and positive, and so reduce the impact of these acute side effects. But as the drug wears off, those effects tend to wear off as well.
Hmm.
Um, a person might be a little bit might have slow reaction time, or be a little bit, motor coordination might be a little bit off for a few hours. So we definitely prohibit people from driving on the day after on the day of the treatment until they get a good night's sleep. But aside from that, there really aren't many side effects when you're giving the drug uh, at this infrequent uh, a pace. So um,
And then the other big question is, how much does this cost? And does insurance cover it? Since
yeah.
this seems to be such a new space, and there seem to be different ways that different states are regulating it also.
Yeah, well, the nice thing about Spravato, the nasal spray, is that it is FDA approved for depression. And
Hmm.
so, and the drug company that manufactures it has done a really good job getting insurance companies to cover it. And so most commercial insurances, as well as Medicare, Medicaid, do now cover Spravato, cover the
Hmm.
cost of the drug. And then, psychotherapy component is also generally covered by most insurances. So, if we're talking about a Spravato treatment, it can cost as little as $10 for the treatment, in terms of the
That's
copay.
very accessible.
Yeah.
And then, of course, the therapy time.
Right, the
Yeah.
therapy time. And ketamine, on the other hand, is used off-label, and because it's off-label, insurance companies will use that as a reason to not
Hmm.
cover it. So that can be a little bit more expensive, several $100s or more per treatment, and can get quite pricey if it's combined with a psychotherapist that
Okay.
isn't accepting insurance. But the Spravato does make it a lot more accessible,
Okay. All
which is
right. And
why
then
which is why we offer it.
what about the others? Psilocybins or
Yeah, so
MDMA?
psilocybin and MDMA, those are still investigational right now. So the only
Hmm.
way
You would
to
need to be part of a
you'll
study.
need to be part of a clinical trial,
Hmm.
and so they're not really commercially available right now.
Hmm.
That is changing, as we mentioned, in places like Colorado and Oregon, and I think the laws are gradually going to be changing around the country. But um, in Oregon, they've had this program going on for a number of years now, and some of the clinics there are closing down because the treatments are so expensive, people can't afford them. So that's going to be something that we have to collectively sort of figure out
Right.
how to make these more
Right.
accessible, which is one of the things that Innermost, as a public benefit corporation, is trying to solve for. It's challenging because we want these to be really widely accessible to the people who really need them.
Right. Yeah, you have the medicine, you
Yeah.
have the cure, and you have a population of people that
Yeah.
are eager for this. I'm sure this really strikes a note with so many people because we all know either ourselves. We're struggling with it currently. We've dealt with it in the past. We have a family member or a dear friend who's struggling with it. This is
Yeah.
just so very hopeful. It's such an interesting field of medicine. We're so grateful that you came in to explore this with us and to illuminate us on this front. We really appreciate it. Just another great topic on Meet Me in the Middle. Tell me the topics you want to explore. Drop a comment down below and send me your questions, send me your ideas, because I am here for you to help all of us together navigate this middle space of middle life on Meet Me in the Middle. I'm Kirsten Cole. Thank you so much for sharing your time with us.